Well, hi, everyone. My name is Natalie Downback, and I'm a Devex contributor and journalist frequently covering maternal health and women's access to reproductive health services. There's currently a $33 billion annual funding gap for ensuring reproductive, maternal, and child health services to all women and girls who need it across the globe. So over the past few years, Devex and MSD for Mothers has been diving deeper into ways that donors can sustainably leverage private sector capacity to help close this gap. So today, we're actually here to zoom in specifically on the role of innovative finance and how it can help address this existing financing gap. And to help us shed some light on this issue, I'm joined by Carmen Villar, Vice President of Social Business Innovation at MSD. Thank you so much for joining us, Carmen. Welcome.
Thank you. Nice to be here with you.
Well, it's great to be having this conversation with you. And one of the first questions that we really wanted to kick off with was, you lead a social business innovation at MSD, and could you talk a little bit more about that? What is social business innovation? What does your team do? Could you talk a little bit about that?
Sure. Yes, happy to. And thanks for asking. I think at MSD, our big mission is really to use our innovative science to save and improve lives. And in social business innovation, our small group, as part of the bigger enterprise, really tries to elevate that mission by catalyzing an enterprise-wide approach to environmental, social, and governance issues. And we focus on two big priorities in our group. One is to make us a differentiated leader in the ESG space. But the other is really to improve health equity and think about the systems needed to be enhanced and how our ecosystem in the healthcare universe can really be improved for those that need it most.
That's great. Yeah, thanks for giving us that overview. And I know that MSD has invested over $50 million through different innovative finance mechanisms. Could you perhaps tell us a little bit more about those investments, the kinds of projects and partners that those have supported, and also how that fits into the wider ESG strategy that you just mentioned?
Yeah, no, it's a great opportunity to talk about this stuff. It's so exciting. At MSD, we have a publicly facing ESG report that we update and release every year. And our 4 material priorities as it relates to ESG in that report focus around employees, ethics and transparency, environment, and access to health. And access to health for a healthcare company like ours is really where we try to lean in. So of our 12 publicly facing goals, 3 are really focused specifically on access. And we talk about our social impact and how we embrace different communities through philanthropic efforts, grant making, partnership, collaboration. We also talk about innovative ways to enable an access environment. So we think about partnering with insurance solutions. We think about creating new channels to distribute and to get our medicines out and make them available. And we also think about things like innovative financing. And, when we look at that gap that you mentioned and the billions of dollars needed to meet our goals only in one area, that's not even looking across all of the SDGs. We have to really think about how we can do things differently. We have to think about partnership. So as a private entity, how we work with the public sector, but how we work with advocates and policymakers. This is really critical to what we do every day. Now, with our social impact investing portfolio, we really try to look at a couple different things. One, obviously, is how are we advancing sustainable global health solutions? How are we supporting the small businesses or small entrepreneurs that have great ideas that we know can really advance the health sector, but just need that capital to get going? So we work with multiple different funds who invest in a lot of innovative small startups or small businesses that are trying to find their way. And to date, we have invested $51 million to companies and funds working to address these underlying barriers to health. And we are so excited because we think about not only how could these ventures really advance healthcare and the health access to health in communities, but we also think about potentially what is in the portfolio and how can we help to make connections back to our business. Now, obviously, we have to keep ourselves a certain arm's length away if that were to happen. But it really is an opportunity for us to see what the innovations are, to help support them, to create that ecosystem. And then if you take it one step further, think about the downstream business advantages that that could potentially create. So, for example, we have a direct investment with Test, which is a company in Latin America, and they're expanding access to mammography services for underserved populations, and really in digital and kind of innovative ways. Well, that makes it easier for people to get the services they need. And there's lots more I can talk about. I can keep going if you want me to, but it's just really exciting to think about doing business a little bit differently.
No, that's great, and super interesting to hear about some of the investments that you're doing. Maybe you could give us just one or two other examples of, some of these small businesses that you're really excited about, and where you think there could be a really potentially huge impact.
Sure. Well, I mentioned funds and I mentioned direct investments. When we first started out, we weren't really sure kind of how to approach this. We didn't have much experience. It's been about 4 years now, I think, that we've been doing this, and we've reached over 32 million people since we started doing this work. And it's really exciting. So when we first started out, we were looking at funds. So we are working with folks like Leapfrog Investments, where they are actually taking on some of the research and investigative opportunities to find out what's really on the cutting edge and where do we see business potential. So we do work with, I mentioned Leapfrog, I mentioned Test earlier, and then even in some countries, thinking about the bricks and mortar work that is needed, building hospitals, building diagnostic centers, creating a safe space for the administration of quality care. So we also have investments, for example, with Evercare, who is a fund that is much more focused on those kinds of things, where they might live very far away from a facility. So there needs to be some kind of a facility closer to a high population density area, for example. So it's everything from the bricks and mortar to the technology and digital innovations, like I was speaking about in Test just a minute ago. And by investing in some of the funds and diversifying with some of the direct investments, we get the best of both worlds.
All right. Well, Carmen, the next question was really about this partnership that we've been having with MSD for mothers and Devex for the past few years, really looking at the ways we can leverage private sector finance and capacity to improve maternal health outcomes. And I wanted to ask, how your work also fits into this wider initiative.
Sure. Thanks for that question. It gives me an opportunity to talk about MSD that I think is really special. Our company has a really long history of, I think, doing the right thing at the right time to help people most in need. We think about things like our commitment to eliminating river blindness, where I would say it's probably one of the longest running public-private partnerships at 35 years, and working all over the world to donate that medicine, but also with partners to ensure that it can get out to where it needs to go, which can sometimes be a challenge. I think about MSD for Mothers as an excellent example of another commitment where our company for the last 12 or so years has been committed to trying to impact and reduce and eliminate maternal mortality. And when we started, there was a $500 million commitment from the company to address this issue for 10 years. We started early and fast, really trying to identify the interventions or the areas that we thought made progress and worked for women, and then trying to pivot to engage in those solutions and implementation for the long term. When we got to the 10-year anniversary of MSD for Mothers, it was really important to renew our commitment and think about how we might finish some of the things we've started, but also continue on our sustainability path to ensure that some of the critical things we had found were actually implemented and made for success to be sustainable. So altogether, $650 million commitment for MSD for mothers from our company. And we're still going strong, and we know we're going to reach that 25 million mothers reached. In that work over time, we have really been a catalyst or tried to work as a force multiplier where we can bring other donors and other funders to the table and really advance additional investments so that hopefully we help close that gap that you were just talking about. Now, a minute ago, I was talking about our social impact investments and how we invest directly into technologies or into funds that might have, improve our societal outcomes. We also have invested as sort of the outcomes funder, I guess I would describe it as, where we are working with other donors and other funders like the Development Finance Corporation and USAID and Devex, different partners around the world, and pooling our resources to create the incentives or the outcome payments for reaching certain critical goals and improvements in the care system. So one example of that is our Moms or Maternal Outcomes Matter initiative. And that was launched in 2019 with a grant funding capital of $5 million from MSD, but at the end of the day resulted in a $50 million debt and grant capital commitment. And that really is what we try to do. How can we catalyze other donors to focus their efforts onto or into the investments that we think will really have a long-term impact? And we have seen that impact in the field. What I would say is that one of our big challenges is around sustaining that impact, right? How do we continue to help people realize that these are sustainable investments that we are making, and that if we can bring other donors to the table or other partners to the table who have something to offer, a lot of times it is resources, but sometimes it's other things, technologies, tools, special expertise in a certain area. So we need other folks to kind of come to the table and commit those resources and ensure the long-term sustainability of some of these investments. We're working with folks like Life Bank, where MSD for Mothers, has invested some money to scale from where Life Bank was working in 2 cities in 1 country to, 12 cities in 3 countries, and really thinking about, how do we ensure supply of a life-saving product that should be easy to get, but is not necessarily always that way. And so by investing in some of these critical programs or critical services, we can really, really expand the reach and hopefully, ultimately, right, save more lives, save more moms. When we think about mothers and girls and this world and the critical role that they play, and we're talking about healthcare today, and they really do serve as that anchor in the family or in the village or in the unit, whatever that might be, to ensure that people get the care, to ensure that people get in for their checkups, to ensure that infants get vaccinations, whatever it might be. That often that role, more than not, is held by women in the family or women in the unit. And so we really do need to look at this, because without having them around, if we lose moms in childbirth, not only do we have potentially adverse outcomes for that baby, we have potentially adverse outcomes for the health of the entire familial unit. And that is really not where we want to go. So I think, and I could go on and on about the role of women in family and in lots of different areas. We're focused on health today, but ultimately our goal is really to improve the lives of women, hopefully make health access easier, and then incentivize startups and innovative ideas so that they can help us solve some of these broader health ecosystem challenges.
Yeah, no, that's great to hear. And I think something just like the COVID-19 pandemic really highlighted the need for moms and children to have access to these routine services, and really how that is such a core building block of health systems. So it's great to see some of the really interesting work that you've been doing in this space for the past few years. And I wanted to ask next, looking back to your work, up until today, what do you think would be the number one lesson learned when it comes to really, the most effective strategies in global health when it comes to, implementing some of these projects and, tackling some of these big challenges that we face?
Sure. Prior to joining MSD, I worked in the public sector and for a long time, 20 years. And I will say it wasn't until the last 5 or so of my career there that I realized how important the public-private partnerships are. We talk about these things all the time. We talk about partnership and the need to come together. But I've only really appreciated that, I think, in the last dozen or so years. We cannot solve these complex challenges on our own. A lot of times you hear about development efforts where people fly in and fly out and, throw some money around and provide some expertise and feedback. But that doesn't work. We know that. We know that we have to come together as a global community to really ensure that not only is that expertise used, utilized, and applied, but that it's sustained and it helps to actually grow and improve the health in a community. We talk about all the work we do in the ESG framework at our company around the Sustainable Development Goals. Of all the goals, there are 8 that we prioritize and really think about when we're designing our focus areas in our programs. Obviously, one of them is number 3 around health. And as with our maternal health commitments, 3.1, we can see that. But one of the really important ones also is SDG 17, where we talk about partnerships. And I almost feel like SDG 17 should be the foundation across all the SDGs, underneath the rest of the 16, because we can't do this stuff alone. WHO cannot do it alone. We MSD cannot do it alone. We need to rely on each other and we need to use each other's strengths. Listen, as a company, there are certain things we're not able to do. I understand that. But what are our core capacities? What expertise do we bring to the table? And how can we help to fill in some of the gaps that maybe another entity needs? And so we really try to maximize a health system capacity. MSD is proud to be supporting the World Health Organization system governance and policy teams' efforts to strengthen the governance of mixed health systems through the country connector in private sector health. I think, I hope that not only folks at WHO, but folks in the public sector, as I started, I mentioned that I didn't always appreciate the help of other sectors, but that we try to really break down the barriers that we have in our minds about who should do what and how they should do it. Because if we can strip that away and really come to the room or the high table or the table or the under the baobab tree, whatever it might be, without any of those assumptions, I think we can truly make progress. We can truly create healthier communities. We can save moms. We can make lives better in families. And at the end of the day, that's really what this work and what partnership is about.
Well, thank you so much for those great insights, Carmen. And I'm sure, especially your idea of SDG 17 really underpinning the other 16 SDGs, I'm sure that will resonate with many of the people in our audience. So thank you so much for sharing that. I'm afraid that's all we've got time for today. There's obviously so much to unpack in this topic, but I really appreciate you joining us here today. So thank you so much.
Thank you. Appreciate it. Always happy to talk about the great things we're doing at MSD.
And I just want to encourage everyone watching to please check out the Maternity Matters content series, which you can find on devex.com. And there's plenty of content there if you want to dig deeper into how the private sector can help improve maternal health. So thank you so much, Carmen, and everyone else watching. Thanks.